Okay, so now we will start discussing about components of wound healing. This is very important question, so please focus on this topic. So now components of wound healing. So what are the phases of wound healing? So first phase is inflammatory phase, second proliferative phase, then remodeling phase and phase of scar formation. So remember four phases: inflammatory phase, proliferative phase, remodeling phase and phase of scar formation. So four phases are involved in the components of wound healing. So you can further divide second phase, that is proliferative phase, into two phases, that is phase of epithelialization and phase of granulation tissue formation. So it depends on you how you want to write in exam, but if you divide proliferative phase in two phases, then it will be better and you can fetch good marks in your exam. So first, whenever there is tissue injury, then there will be release of platelets. So after release of platelets, they will adhere. There will be adherence of platelets, aggregation and or degranulation. Then there will be formation of clot and release of mediators of inflammation. So these chemical mediators will do vascular changes, cellular changes, and all these phases of inflammation will start. So we will start from first phase, that is inflammatory phase. So inflammatory phase, so injury results in the release of mediators of inflammation, mainly histamine from platelets, mast cell and granulocytes. So in the first phase there will be release of mediators of inflammation. So release of mediators of inflammation, mainly histamine from platelets, mast cells and granulocytes. So there will be release of mediators of inflammation, mainly which mediator will release histamine from the platelets, mast cells and granulocytes, and this will result in increased capillary permeability. So there will be increase in capillary permeability. Later there will be kinins and prostaglandin act, and they play a chemotactic role for white cells and fibroblasts. In the first 48 hours, polymorphonuclear leukocytes will dominate. They play a role of scavengers by removing dead and necrotic tissue. So what is happening in inflammatory phase? So whenever there is any injury, it will result in release of inflammatory, first there will formation of clot, there will be release of inflammatory mediators, mainly histamine will be released from the platelets, mast cells, granulocytes. So we know that whenever there is injury, platelets will go there and check what is happening there. They will try to stop, they will try to form a clot, and because of clot formation uh, there will be reduced bleeding. They will try to cope up with situation, they will try to stop bleeding. So there will be release of histamine from platelets, mast cells and granulocytes, and these mediators of inflammation will increase the permeability, and will increase the capillary permeability. And after histamine there will be kinins and prostaglandins will come into play, and they will play chemotactic role. What is chemotactic role? They will attract white blood cells. So because of release of kinins and prostaglandins, white blood cells and fibroblasts will be attracted to the site of injury, and in the first 48 hours polymorphonuclear leukocytes dominate. So in the first 48 hours, in the higher in the majority of this, majorly we can see polymorphonuclear leukocytes. And uh, what is the role of polymorphonucleocytes? They will play a role of scavenger by removing dead and necrotic tissue. So first there will be phase of inflammation. In the phase of inflammation there will be release of mediators of inflammation. After that, kinins and prostaglandins will act, they will play chemotactic role, and after that WBCs will dominate, and they will play role of scavenger. They will remove all the dead and necrotic substances. They try to make wound clean. So they will remove all the dead and necrotic substances. So wound inflammatory phase. So wound in inflammatory phase, there will be bleeding, then vasoconstriction and thrombus formation will occur, then hemostasis. So for hemostasis, platelets release will occur, then platelet derived growth factor, platelets factor 4, transforming growth factor beta. This will be released by the platelets, and this will attract polymorphonuclear leukocytes and macrophages, and they will remove all the dead and necrotic substances. So this is about first phase, which is phase of inflammation. Now second phase, proliferative phase. So you can divide this phase into you can further divide this phase into two phases, that is phase of epithelialization and phase of granulation tissue formation. So what is proliferation? As the name suggests, in the proliferative phase there will be proliferation of something, but what? So there will be proliferation of fibroblast. So there will be proliferation of fibroblast. And in the phase of inflammation, name suggests there will be phase of inflammation. After inflammation there will be proliferation. So what is happening exactly here? So between third and fifth days, polymorphonuclear leukocytes diminish. So we know that in the first 48 hours there is role of polymorphonuclear leukocytes. After 2 days, after 48 hours, there will be diminished role of polymorphonuclear leukocytes, and monocytes increase. So monocytes will increase, and they will phagocytose all the dead and necrotic tissue. So after that, monocytes will increase, and by the 5th and 6th day, fibroblasts appear, proliferate, and eventually give rise to granulation, eventually give rise to protocollagen. So by the 5th and 6th day, fibroblasts will appear and proliferate and eventually give rise to protocollagen. So remember, this is MCQ. By the 5th and 6th days, fibroblasts will appear. So between 3rd and 5th day, monocytes will increase. After that, between 5th and 6th days, fibroblasts will appear. They will give rise to protocollagen. We know that fibroblasts play a role in the collagen synthesis. So they will try to synthesize collagen. For the synthesis of collagen, they will synthesize protocollagen. Protocollagen will be converted into collagen with the help of protocollagen hydroxylase. So it is hydroxylation reaction. So it is hydroxylation reaction. Now fibroplasia along with capillary budding give rise to granulation tissue. So this is important events. So there is formation of granulation tissue. Epithelialization occurs mainly from the edges of the wound. This is important point. Epithelialization occurs mainly from the edges of the wound by a process of cell migration and multiplication. This is mainly brought about by marginal basal cells. Thus within 48 hours the entire wound is re-epithelialized. So first, in the proliferative phase, there is first formation of epithelium. So there is first, write in your exam, first write phase of epithelialization, then write phase of granulation tissue formation. So in the phase of epithelialization, there will be formation of epithelium from the edges of the wound by the process of cell migration and multiplication. This is brought about by marginal basal cells, and within 48 hours entire wound is re-epithelialized. After that, there will be after that fibroblast will come into play at the 5th or 6th day, and they will eventually give rise to protocollagen. Collagen will be converted into collagen, and there will be fibroplasia, and this fibroplasia and along with capillary budding give rise to granulation tissue formation. So important two phases are epithelialization and granulation tissue formation. Now remodeling phase. So third phase is remodeling. So what is happening in remodeling phase? So it is brought about by specialized fibroblasts. So remember, important cells of remodeling phase are specialized fibroblast. In the phase of proliferation, fibroblast and monocytes were there, but now specialized fibroblast will come into play. And what is the name of that fibroblast? Myofibroblast. So myofibroblast will come into play. Because of their contractile element, they are called myofibroblast. They have contractile element like muscle, and we know that muscle is myo is named for muscle. So as they have contractile elements, we called them as myofibroblast. it's nature's way of reducing the size of defect. So it is nature's way of reducing size of defect. So there will be phase of contraction. Wound contraction will occur in the remodeling phase. So it is a nature's way of reducing the size of wound because of myofibroblast. Myofibroblast will contract. They play their contract. They will play a role of contractility, and because of this contraction there will be reduction in the size of wound, and this will help in fast wound healing. Wound contraction readily occurs when there is loose skin. So readily occurs when there is loose skin, as in back and gluteal region. Why it is occurring? If there is loose skin, then there is more space for contraction. So as there is more space for contraction and contraction is occurring fastly, so there will be easy healing. Skin contraction is greatly reduced when occurs over tibia or malar surfaces, as there is less space for contraction. Now last phase is phase of scar formation. This is last phase. Following changes takes place during scar formation. So what is happening in scar formation? Fibroplasia and laying of collagen is increased. So fibroplasia and laying of collagen, these are we have seen these two things in phase of proliferation. So whatever changes are happening in phase of proliferation are increasing in phase of scar formation. Then fibroplasia and laying of collagen is increased. Vascularity becomes less. So there is devascularization phase. Then epithelialization continues. So epithelialization is happening in phase of proliferation. It also continues. In growth of lymphatics and nerve fibers take place. And remodeling of collagen takes place with cicatrization resulting in scar. So there is remodeling of collagen. So we will revise all these points. So what are components of wound healing? So components of wound healing are in phase of inflammatory phase, then proliferative phase, then remodeling phase, and phase of scar formation. In the inflammatory phase, there is all the changes all the changes which are happening in inflammation, in regular inflammation, that are happening in that are also happening here. So in the inflammatory phase, there will be there will be release of platelets. Platelet will form clot. Platelet will release there will be release of chemical mediators of inflammation. These chemical mediators of inflammation, mostly histamine, will be released from platelets and platelets, mast cells, and granulocytes. What mediators of inflammation will do? They will increase the capillary permeability. After histamine, there will be release of other mediators like kinins and prostaglandins. So and what is their role? They will play a chemotactic role. They will attract white blood cell and fibroblasts, and this will play role in clot formation. So in the first 48 hours, polymorphonuclear leukocytes will predominate. They will play role of scavenger. They will eat all the dead and necrotic debris, and they will clear the infection. They will try to make wound clear and uncontaminated. So after phase of inflammation, there will be phase of proliferation. So what is happening in phase of proliferation? In the phase of proliferation, by the third and fifth days, polymorphonuclear leukocytes will decrease, and there will be role of monocytes. Monocytes will increase, and by the fifth and sixth day, fibroblasts will come into play. Fibroblasts will synthesize protocollagen, which will be converted into collagen with the help of protocollagen hydroxylase. So this is hydroxylation reaction. Because of there is synthesis of collagen, there will be phase of fibroplasia and capillary bedding. This will result in granulation tissue formation. So there is granulation tissue formation. Also there is formation of epithelium. So there is phase of epithelialization. So phase of epithelialization will occur from the edges of the wound. So there will be migration and multiplication of the cells from the edges of the wound, which will result in formation of intact epithelium within 48 hours. Now phase of remodeling. So what is happening in remodeling? So so in that phase, specialized cell, that is specialized fibroblast, will come into play. name of that fibroblast is myofibroblast, because they have contractile elements. So they will try to contract the wound, and because of contraction of wound there will be reduction in size of the wound. So there will be reduction in size of the wound, and wound healing will take place faster. After that there is phase of scar formation. So all the changes which are happening in the proliferative phase, they will increase. Example, there will be increase in collagen synthesis, there will be increase in fibroplasia, and there will be devascularization will occur. So there will be decrease in vascularity occur. Also uh, there will be invasion of lymphatics and nerve fibers. So all these things will contribute, and there will be ingrowth of lymphatics and nerve fibers. Epithelialization continues, and remodeling of collagen takes place with cicatrization resulting in scar formation. So this is important question, phases of wound healing. Thank you.